Welcome to Functionally Enlightened. I'm your host, Dr. Sharon Surita. I want to start off today by thanking all of you for listening to the show and for sending in your preferred topics as well as general comments and questions. It's a great way to receive this type of feedback as we aim to provide helpful information to our audience in both open discussions about alternative and holistic practices as well as chronic illness coping strategies. The journey to optimal health begins in the gut. Understanding the intricate balance within the digestive system is crucial for overall well being. Gut health impacts not only digestion, but also influences the immune system, hormonal balance, and even mental health. The GI Microbial Assay Plus, or GI MAP, is a revolutionary diagnostic tool that provides a comprehensive analysis of gut health. This presentation explores how the test unveils hidden aspects of digestive well being. The GI map measures various parameters, including microbial abundance, antimicrobial agents, immunological markers, and inflammation indicators. The three types of dysbiosis assessed by the GI map are known as insufficient dysbiosis, inflammatory dysbiosis, and digestive dysfunction. Each type reveals specific imbalances within the gut microbiome. Let's talk about some of the key markers assessed by the GI map. Actually, before we dive into the specifics of the results, we're going to discuss sample collection. Begin by filling in your information, that's the name, date of birth, and collection date on the specimen vial provided. We want to put our gloves on and set up all of our materials for the sample collection. I recommend using a large plastic bag to hold the tray in place during deposition for a hands-off approach. Do not discard the pink liquid in the specimen vial. Using the spoon attached to the cap of the vial, spoon stool samples from various areas of the collected stool. Make sure that the specimen vial is filled to the line marked fill line on the label. Carefully mix the stool with the spoon, replace the cap, and then shake it vigorously for about 30 seconds. After this, you can fill out the test requisition form completely and place that into the document holder on the back of the specimen bag. Be sure to write the date of the sample collection on the form and indicate the payment type, as this has to be completed and payment included for the sample to be processed. Then you place the capped specimen vial containing the collected stool sample into the specimen bag along with the absorbent pad, and then you can seal that bag. Place that specimen bag with the collected sample and the test requisite form into the kit box. You can ship all of this as the completed kit box back to the Diagnostic Solutions Laboratory using the FedEx Clinical Pack mailer that is provided within your kit. The sample must be received within 6 days of the sample collection. There are several categories that are broken down in the results of a GI map. With the intestinal markers, we're going to take a closer look in a case study that I'll be presenting next. However, some of the markers include steatocrit, elastase, beta-glucuronidase, occult blood, secretory IgA, antigliadin IgA, and calprotectin. Medical providers use the GI map diagnostically and in some cases may prescribe medications based on the results of the screening, particularly if pathogenic bacteria are noted. As an FDN, I do not diagnose or treat specific diseases. Rather, I work in a non-specific manner to address the hidden stressors uncovered by the diagnostic screenings used. However, with the presence of pathogenic bacteria, it's always suggested to speak to a healthcare provider. The section in the GI map results titled Commensal Bacteria. These are keystone bacteria that are the pillars of the microbiome. They play a crucial role in maintaining a balanced and healthy microbiome within the human body. These bacteria are considered symbiotic, meaning they coexist with the host, the human in this case, without causing harm or benefit. Commensal bacteria have many functions. They can contribute to overall diversity and balance of the microbiota in various body regions such as the gut, skin, and other mucous membranes. This diversity is essential for optimal health. Secondly, these commensal bacteria help create a protective barrier, preventing harmful pathogens and opportunistic bacteria from colonizing and causing infections. They compete with potential invaders for the nutrients and attachment sites, thereby supporting the body's defense mechanisms. In the gut, commensal bacteria aid in the digestion of certain dietary components that the human body alone can't break down. They also produce essential nutrients such as vitamins that contribute to overall health. Commensal bacteria play a role in educating and modulating the immune system. Exposure to these bacteria helps the immune system distinguish between harmless commensals and harmful pathogens, preventing unnecessary immune responses or autoimmune reactions. Some commensal bacteria are involved in metabolic processes, influencing the host's metabolism. For example, they may participate in the fermentation of dietary fibers, production of short-chain fatty acids that contribute to energy metabolism. Commensal bacteria contribute to the maintenance of the mucosal barrier, which lines various organs and interfaces with the external environment. A healthy mucosal barrier is essential for preventing the entry of harmful substances and pathogens into the body. Also, exposure to commensal bacteria early in life is crucial for the proper development and maturation of the immune system. This exposure helps shape immune responses and tolerance mechanisms. Now, dysbiosis is an imbalance in the microbiota, and it's associated with various health issues. So the commensal bacteria play a role in preventing dysbiosis by maintaining a harmonious microbial community. In summary, commensal bacteria contribute to the overall health and well-being of the host, us, humans, by maintaining microbial balance, protecting against pathogens, supporting digestion, modulating the immune system, and participating in various metabolic functions. The delicate relationship between humans and commensal bacteria highlights the importance of maintaining a diverse and balanced microbiome for optimal health. Another page of the results in the GI map includes the opportunistic bacteria, which are a type of microorganism that normally resides harmlessly in the human body. However, they can become problematic under certain conditions when the balance of the microbiome is disrupted or when the host immune system is compromised. The issues with opportunistic bacteria can include overgrowth and infection. So the opportunistic bacteria can proliferate and cause infections when the normal checks and balances in the microbiome are disturbed. This overgrowth can lead to localized or systemic infections, especially in individuals with weakened immune systems. Dysbiosis is the other one. Opportunistic bacteria contribute to dysbiosis, as we discussed, which is an imbalance in the microbial community. The imbalance may result from factors such as antibiotic use, changes in diet, or other disruptions to the normal microbiota. This creates an environment where opportunistic species can thrive. Then the immune system may be challenged as well. Individuals with compromised immune systems, such as those with autoimmune conditions or chronic illnesses, or undergoing immunosuppressive treatments, are more susceptible to opportunistic bacterial infections. The immune system may struggle to control the overgrowth of the bacteria. With secondary infections, the opportunistic bacteria can take advantage of weakened or compromised tissues, and this leads to a secondary infection. This is often observed in the context of pre-existing conditions or wounds where the normal defenses are already compromised. Next, we have antibiotic resistance. Some opportunistic bacteria have the potential to develop antibiotic resistance. Overuse or misuse of antibiotics can contribute to the emergence of drug-resistant strains, making infections more challenging to treat. And then the inflammatory responses we discussed also are an overgrowth. And so it triggers an immune response in the host, and it can contribute to various health issues, including autoimmune conditions, gastrointestinal disorders, and metabolic disturbances. So there's implications for chronic diseases due to these imbalances in the microbiome, and specifically the presence of these opportunistic bacteria. They're linked with or exacerbate the chronic diseases, some of them such as the irritable bowel syndrome, metabolic syndrome, and other conditions. Addressing issues with opportunistic bacteria often involves restoring that microbial balance through dietary interventions, probiotics, and other strategies aimed at supporting a healthy microbiome. This helps to maintain a robust immune system, minimizing factors that can play a crucial role in preventing opportunistic bacterial growth and related complications. Imbalances in the microbiome include the presence of opportunistic bacteria, and these have been linked to the development or exacerbation of chronic diseases such as inflammatory bowel disease or metabolic syndrome, and also neurological conditions. Addressing issues with these opportunistic bacteria often involves restoring the microbial balance through dietary interventions, pro and prebiotics, and other strategies aimed at supporting a healthy microbiome. Maintaining a robust immune system and minimizing factors that disrupt the microbiota can also play a crucial role in preventing opportunistic bacterial overgrowth and the related complications. Let's talk about H. pylori. This is a type of bacteria that can infect the stomach and the upper part of the small intestine. It is a spiral-shaped bacterium that has the ability to survive in acidic environments of the stomach, and it can burrow deep into those tissues. H. pylori infection is one of the most common bacterial infections worldwide. Now, the exact mode of transmission is not completely understood, but it's believed to occur through oral to oral or fecal to oral routes. Person to person transmission is common, especially in areas that have very poor sanitation. H. pylori, it colonizes the mucus lining of the stomach and the duodenum, which is the first part of the small intestine. The bacteria can evade that acidic environment of the stomach by producing substances that neutralize stomach acid. So these can be captured in the GI map results under the virulence factors. Oftentimes, this initiates downstream disruptions into all the bodily systems. While many people with H. pylori infections might not experience symptoms, the bacterium is associated with various gastrointestinal conditions. It's a major cause of peptic ulcers, and it's linked to gastritis, which is inflammation of the stomach lining, as well as stomach cancers. Now, symptoms of H. pylori infection can include abdominal pain, bloating, nausea, and in some cases, vomiting. However, many infected individuals might be asymptomatic. Diagnosis in the medical world often involves a combination of methods, including blood tests, breath tests, and endoscopy. The endoscopy will allow for direct visualization of that stomach lining and the collection of tissue samples for laboratory analysis. Treatment in the medical model often includes antibiotic therapy as well as stomach acid reducers. Now, H. pylori plays a significant role in this development of peptic ulcers, as we've discussed, including both gastric ulcers in the stomach and the duodenal ulcers. The bacterium weakens that protective mucus layer in the stomach, and that allows for the acid to damage the underlying tissues. Virulence factors, when present, affect the environment of the stomach. These factors contribute to its ability to colonize and induce inflammatory responses in the stomach lining, which can potentially lead to additional gastrointestinal conditions. In these results that I'm presenting, there is a high quantity of H. pylori, however, no virulence factors are there. So when it's high, or when virulence factors are present, we should always aim to fully eradicate the bacteria, promote the healing of the ulcers, and reduce the risk of complications. There are functional strategies that can be implemented to help restore your body to a more balanced state. The GI map also provides a look at the fungi and yeast as well as viruses. And so one of the most common ones that we encounter with the GI map is Candida species. Candida is a genus of yeast, and its overgrowth, particularly Candida albicans, is the one that's most common. It might be associated with a variety of symptoms, including digestive issues, fatigue, and immune system challenges. When we examine the fungal and yeast markers on the GI map, we gain that specific information about the presence and abundance of fungi and yeast, and the presence of it inside of the gastrointestinal tract specifically. Monitoring these fungal and yeast markers is crucial for assessing the balance of the gut microbiome. An overgrowth of fungi and yeast can disrupt the microbial equilibrium, leading to various gastrointestinal symptoms and impacting overall health. The GI map helps in identifying these imbalances, allowing for targeted interventions to restore gut health. It's very important to interpret these results in the context of the individual's overall health and symptoms. And this enables personalized strategies for gut restoration and maintenance. The GI map also includes markers for parasites and worms, aiming to detect various gastrointestinal pathogens. Among these, Blastocystis hominis is a common protozoan parasite found in the human digestive system. It's been associated with gastrointestinal symptoms and might contribute to digestive disturbances. Identifying such parasites through the GI map allows for a targeted intervention to address these infections and promote gut health. Now, again, Blastocystis hominis can be a very challenging one to treat for several reasons. Firstly, there's a significant genetic diversity among different strains of Blastocystis, and it makes it difficult to find a one-size-fits-all treatment. Additionally, the parasite can exist in different forms, including a cyst stage, which may render it less susceptible to certain medications and antimicrobials. A lot of insight can be gleaned from the final page of the GI map, which discusses the intestinal markers, the intestinal health markers. And the first one that is listed is steatocrit. So steatocrit is a marker that tells us about the ability to digest fat. When it's elevated, this shows impairment. Our foundational labs include the Metabolic Wellness Panel, which provides specific insight into protein digestion also. And so when we can combine these two readings, we can infer that there might be issues with breaking down all macronutrients if both of these are elevated. The next marker that is provided in the GI map intestinal health markers is elastase. So this one measures pancreatic function. We generally like to see this one above 500. So when elastase is insufficient, we can note that there's pancreatic insufficiency, and dietary changes along with supplementation might be beneficial for the person. Another marker is beta glucuronidase. So when this one is elevated, we can make the inference that glucuronidation is undoing the conjugates that were formed initially, and that was a binding of hormones. And so when these are unbound, they're backing up into the liver, more is being recirculated along not just the hormones, but other toxins. And this can also indicate bacterial overgrowth. Another marker here that stands out and that is used in the medical model as well is occult blood. We don't want to see occult blood. So this identifies hidden bleeding in the gastrointestinal tract, and it should be looked into, especially if we know that something like hemorrhoids isn't an issue at the time. Another marker is secretory IgA or SIG-A, similar to when we check this marker in the salivary level. It tells us the state of the immune system, but specifically in the gut. So it measures the mucosal immune function. Another marker that is presented in the GI map is the anti-gliadin, IgA. This tells us antibody production relative to maybe an ingestion of gluten products. Another newer marker that's presented in the GI map is called the eosinophil activation protein. This one is also an inflammatory marker, and in the labs that I've seen, or in the results that I've seen with this marker, I haven't seen too many with elevations. So in general, I want to look at the secretory IgA, the anti-gliadin IgA, and also the one on the bottom here. If you're viewing this presentation, calprotectin is listed, and this one also should remain very low. When we see it in the higher range, that is definitely pointing to inflammation in the gut. Now, with secretory IgA, in this case that I'm presenting, it's actually quite high. So we expect that an immune system response is very active, very dominant, and it's maybe causing the other markers to be on the lower end, and vice versa. If we saw SIG-A or the secretory IgA as being low, then we expect that possibly there's higher than indicated of the anti-gliadin IgA and possibly calprotectin. So that's something to keep in mind when you're looking at these intestinal health markers on the GI map. The GI map offers a good look at what the state of the gut health is, and it can tell you what kind of dysbiosis exists, if any, whether it be inflammatory or it could be the digestive dysfunction in general, or also it could be an insufficiency of the commensal or the keystone bacteria. Also, it can give you insights into the digestive function in general. So whether you're having issues with fat digestion, protein digestion, maybe there's not enough of the pancreatic enzymes being generated. So we have a GI map mini package that's the passport to a comprehensive assessment, and it can help to unveil mysteries of your own gut microbiome. What's included? It includes a thorough analysis of commensal bacteria, opportunistic pathogens, and more. Insights into the markers of inflammation, digestive dysfunction, and intestinal health. Personalized recommendations for healing opportunities would be developed based on your unique results. So why wait? Take the first step towards your gut wellness. You can visit our website at www.functionallyenlightened.com to enroll in our GI Map mini program today and uncover the keys to a healthier you. Thank you for listening. We'll see you next time.